on the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. The time now is 6:24. Most of us get these at one time or another. They could be stress-related, diet-related, work-related, whatever the cause. Headaches are a real pain. And more importantly, what is the best way to get rid of them? Joining us this morning to help is Baptist Health's Dr. John Allen Cockerell. Thanks so much for being here this morning. This is an important topic. I think, of course, everyone has had a headache at some point in their life. So first off, let's talk about how common they are. A lot of people do get them, some at different rates.
Right, absolutely. So extremely common, right? You look at the recent numbers, 18% of all U.S. adults actually complain of chronic severe headache, and 10% of those actually say those headaches occur on a near daily, multiple time per week basis. So that's a lot. I mean, you're talking about millions of people with pretty significant issues, right? The overall burden of disease here is pretty impressive when you kind of think about the whole picture. I mean, people are missing out on, hanging out with friends and family and having to isolate themselves, missing out on work opportunities. And so it becomes a big deal, right? So it's very, very common. Some of the common types that we see, there's, cluster migraine you hear about all the time, and tension. You mentioned stress related as well. So quite a few different types. Those are some of the common ones, right? You asked about the common headaches. But the spectrum goes on from there. There's even all the way up to emergent type headaches that we treat in the emergency department. So lots of different things have been going on here, but very, very common, and that's why I wanted to bring it up, because hopefully I can give some tips on how to help out with some of those.
You mentioned the ER. I mean, certainly that's some types of headaches, but for the most part they can be treated at home. Let's talk about some of the treatment options.
Sure, yeah. So the good news with headaches, I guess, is that there's so many different kinds, but also so many different medications that we can offer. There's even research going into complementary and alternative medicine fields, for headache treatment. So some medications are targeted to take every day to prevent a headache from forming in the first place. Some headaches, especially for migraine patients, and by the way, not all headaches are migraines, right? I have to say that because it matters in terms of treatment, But for those that are migraines, we give what we call abortives. So a whole class of medications, you take them as needed when a headache starts, and the whole point is to abort or get rid of the headache before they progress. There's injectables, new one on the market recently. Again, just a lot of options there for us to hopefully help you out with. So if you're having issues, please come see your doc, if you're concerned, because there are treatment options available.
From a recovering hypochondriac, a lot of us, I know you're out there too, going, oh, I have a headache. Is it a brain tumor? How severe? When should we go to the ER? When should we seek immediate treatment for a headache?
Right. So great question. And I'm not trying to scare anybody. I'm hoping just to kind of educate, but there are some severe headaches out there, and so to answer your question about the kind of acute, life-threatening, emergent type headaches, you think about signs and symptoms that are associated with the headache, especially neurologic issues. So complete, numbness or an inability to move an extremity, acute vision loss, stroke type symptoms, facial droop, asymmetry, slurred speech, all those kinds of things in the setting of headache definitely need to be seen in the emergency department. A couple of things here real quick. I know we got to move on, but timing is a big deal too. So if you haven't had headaches or a history of, you're middle-aged or maybe a little bit older, and now you're developing these things, please go get that checked out as well. Another thing that'd be concerning to us, a little more insidious, less kind of in your face, this is a big deal, right? A little more insidious, but that's the constitutional signs and symptoms. So if you're having headache in the context of night sweats, unintentional weight loss, not going to the gym trying to lose a few pounds, but really unintentional weight loss with the night sweats and extreme fatigue in the setting of headache, please go get that checked out as well.
Great information. As always, the good news, most headaches are common and can be treated at home. But if you have any questions, you can always call the Baptist Health Helpline at 1-888-BAPTIST or talk to your physician. Thanks so much, Dr. Cockerell, as always.